Yes, hello, I'm Justin Whatling. I'm the Chair for Health at BCS, the Chartered Institute for IT.
What do you think are the priorities for health organisations?
Well, there's lots of challenges for how we're going to create a high quality service that costs less money to run. And I think there's going to be a lot of focus that needs to be applied to the demand side, understanding our populations of people better, whether they're populations of people being readmitted to hospital or populations of diabetics that need better care. We're going to spend a lot more time on understanding the supply side and where is care best delivered across those networks of care that are evolving. We're going to need to spend time understanding how we apply the evidence base, not just to nodes like in the hospital environment or in general practice, but actually how do we make that evidence base work right across the care continuum from the time patients are treated in hospital all the way through to how they're managed at home. And we've got to do all of that in the context of the financial challenges and also the changes around the regulatory environment as well to make the optimal choices. So I think there'll be some particular challenges for the hospital providers in this. There's a number of things that they can do as reactions and responses. They can help to look at how they decrease their costs and make their services more efficient. And any good business would do this year on year anyway. But they also need to find ways of optimizing care delivery, where a patient's going to be treated, looking upstream for opportunities for patients not to come into the hospital environment, and looking downstream for how they provide their specialist services out into community settings to keep patients treated in other settings. And at the same time, making sure that as those networks of care evolve, how do they secure their income and be part of those new networks of care as they help to put them in place.
What do you think are the major issues for information and IT in our UK health systems now?
So I think there's probably three things that I wanted to point out. One is we have to complete that basic information estate. So for a long time in the United Kingdom we've been computerised in primary care with GPs, but actually we're still playing catch up to a degree in the hospitals and the secondary care setting, and we want an information estate that works for the patients that have long-term conditions right across. So we have to now press on and get those remaining patient record systems implemented, making sure we can get the data out that's going to be useful from them to help coordinate and manage patients' care across that continuum. I think a second important area, which kind of flows on from that, is how do we change the culture of how we use information? So I think for a very long time we've been collecting information for performance metrics, which have been important, but how do we create much more of an inquisitive environment where clinicians and indeed patients themselves can understand information presented to them and use that to change the way they deliver their healthcare services. And that's quite a radical change. Fundamentally it's a change in the culture about how we use information from computer systems. And the third area that I think is going to be really important is that capacity for change. And I think what we've seen with a lot of IT projects, that they've been IT projects, and not really sort of transformational projects and changing the way healthcare services can be delivered. And it's a real challenge, especially with the financial pressures on hospital services and others. How do they build that change capacity? How do they organise themselves to make sure that these projects are transformation projects, that they get their clinicians working in new ways, that they're interfacing to patients with new media to avoid face-to-face visits? How do they do those things? So they're going to need to spend more time finding the parts of their organisation that are much more dedicated to helping continuously with that change process if we're going to get those benefits that IT has the potential to offer.
Health systems are going through significant change at the moment. What do you think are the main implications for IT departments and services as a result of this?
So I think there's a really big opportunity here for IT departments, services and all the services around it, because it's the opportunity now to engage with the business of healthcare, the management teams, but also with the clinicians, the senior clinicians and all the clinical leads of different areas. Because what we're trying to do is use the technology as a tool to transform the way those healthcare services are delivered. How do we create a continuous performance improvement culture so we can reduce pressure ulcers and falls and areas like that, and get it clinically led that change? How do we drive through a programme that can save the organisation money, which is important too? How do we deliver services in a new way? Do the patients need to come in? Can we do those follow-ups with patients when they're at home using telephone or other types of service? So I think the opportunity here is for the IT departments to engage with the mainstream business and the mainstream clinical professions to work out together actually how they can together create a real good case for change and then drive it through and make sure that it's very much driven around the benefits, those predicted benefits they think they're going to get, and then measure them out and make sure they're achieved. So I think that's the big opportunity for IT, is to really come out of the back room and spend a lot more time focused on the business of healthcare and how that can change for patients better.
Who should attend this event and why?
Yeah, so we've designed the event to be good for managers, for clinicians and for IT and informatics professionals. It's really important they can all come together and understand how IT can change the healthcare environment. We've made it very user-centric. It's important to us. It's a really good opportunity to have that dialogue on what are those emerging user requirements and how we're going to work together. So we've designed the whole programme around a set of partners to make sure the work streams give that user-based experience. So we've been working with NICE, with the Care Quality Commission, HQIP, Monitor, Royal College of Nurses, Royal College of Physicians, and importantly this year a new group, the Private Health Information Network. So all of those groups have helped put together really strong content for our users to come along. I think then from the delegate perspective and what they can hope to get out of this, I think part of it's about learning new skills, and there's a lot to offer here about how they can do that. But also for them to establish new contacts that they'll need to help support them when they're putting their projects into place locally. And to give them the opportunity really to learn best practice, who's got good examples of where things have gone well, but also good examples of where things haven't gone so well as well. So they can use all of that knowledge and understanding when they go back and don't feel like they're on their own. They feel like there's a support network behind them and actually that they can get on and help to do those transformative projects in their own environment, understanding better how others people have achieved that themselves.
Over recent years, the event has taken on a more international feel. Can we expect more of this?
Yes, expect more of this. Obviously important that we learn from the best that's available internationally to help guide us here in the UK. And also we've got a role to show what we're doing here and showcase that externally as well. So we'll do more and more of that. This year we're particularly pleased that we've got Archbishop Emeritus Desmond Tutu in our opening session in his role as the primary ambassador for the Global eHealth programme. So yes, an increase in the international component for this year, and we'll see more of that as the years go by.
What's BCS's own engagement in the event?
Yeah, so obviously it's a BCS event, which we're very proud of, but BCS Health has been very active in this last year or more, helping to get things in place for the information strategy. One of the pieces of work that we've been doing is to get some patient guidance for patients and safe record keeping. So we've launched that in February of this year, and we'll have a talk that's dedicated to that at the conference. Another important area for us that we talked about last year at the conference was getting in place a electronic patient record maturity model to help organisations understand what are those stages of attainment that they can get on their way to being paperless, as we would like them to be by 2018. So we've been working in BCS very closely with HIMSS to look at the European EMR adoption model and seeing whether it's fit for purpose for the UK market. We've now got some 20 trusts that have gone through the analysis, and we're just actually meeting at Healthcare Computing Conference to look at whether any changes are required or not to the model before we publish that. So that's, again, there's a dedicated session and in a stream that HIMSS are running on that topic. We're also involved in some other talks. So we've got somebody coming along talking about equality in informatics, which is an important topic for professionals, and a talk around entrepreneurship. Again, very important with the increasing engagement of small to medium-sized enterprises in the healthcare IT marketplace. And then finally, BCS are running a stream, as you'd expect, on professionalism to talk about what we can do and how we work with people to help improve the professionalism of IT.